NLTV radiation oncologist Dr.Sorun Shishak kun jana mana Medanta Hospital Gurgaon ase tai logot bonaikina June 25 sham khota kurise. Dr.Sorun kushiki Medanta Hospital 3 din karne free medical camp ki Kohima te Nagaland sarkar logot milikina arjun kurise. June cancer report awareness public ke cancer risk te educate kurise, prevention, early detection or treatment options can be janaise. The NLTV ke janaishi ki Medanta Hospital Nagaland sarkar logot ekta MOU sign kurise. Chief Minister Health Insurance Scheme te Accreditation Limited aro etu scheme under the cancer treatment be cover kure kurise. IB reporter Grace logot detailed report saisa.
Today we are here with the Medanta Government Hospital in India that provide a world-class treatment to the people, and Dr. Sorun, oncologist from Medanta, is here with us. Thank you, ma'am, for joining NLTV. Ma'am, can you introduce yourself and tell us more about your visit during this free medical camp that has been organized in the state capital of Kohima for 3 days?
Yes, thank you very much. I'm Dr. Sorun Shishak. I'm a radiation oncologist at Medanta Gurgaon, and I have come as part of a team from Medanta comprising of oncology, cardiology, internal medicine, nursing staff, as well as the marketing team, and we're here for 3 days for a medical camp. It's a free medical camp. It's in collaboration with various industries of Nagaland Government, and in 3 days starting from today, we're basically doing free blood test, free consultations of all the patients who are coming, as well as all the employees of all these government offices who are in collaboration right now. They're coming and we're checking them, and we're doing free consultation. So we're also doing free blood tests, certain tests like ECG, pulmonary function test for the lung functions, and some other miscellaneous blood test. Yeah.
So, ma'am, the Medanta Hospital, in collaboration with the IDEN, the government of Nagaland, and Directorate of Industries and Commerce, and the Nagaland Police as well, the Olympic Association. Organizing for 3 days medical camp, focusing on this. So, what was the main focus that it's come up with a free medical camp in the state capital of Nagaland?
So, one is from the oncology perspective, we are definitely seeing a rise in cancer incidence. Okay, so if we talk about the cancer incidence as per the National Cancer Registry in India, we have about 100 cases per 100,000 people. So that translates to about 1 in every 9 Indian will have cancer in their lifetime. Okay, so that means it's a serious issue. And not all individuals have access to treatment, to hospitals, to even to oncologists, right? So this is one step forward in the direction where we are able to now reach out to certain areas and provide our expert opinion. And if there are patients who require certain techniques which are not available in the state, then likely we are able to guide them in a better way.
Okay. So as we all know that the cancer disease has been increasing day by day, I can say that. And so can you tell more about is that the cancer on the rise, or what are the common cancer that has been detected in India?
Yes, so like we mentioned, cancer is on the rise. And what are the common cancers? So in India, the commonest in females are breast cancer, and followed by the gynae cancers, which is cervical cancer, uterine cancer, and ovarian cancer. These are the commonest top 4 cancers. And in males, it is lung cancer, followed by the oral cavity. So oral cavity is mouth cancers and tongue cancers. These are the commonest ones.
So can you tell more about the breast cancer?
Yes, and just one more thing. When you mention about the increasing, incidence, it could be because of so many reasons. One is, the life expectancy is increasing, which means people are living longer now than before, right? So as people age and they are able to live longer, even the chances of developing cancer increase. Okay, so another reason is we now have very, active population-based cancer registries, which are actively capturing the data. So it may seem like it is also on the rise. Another thing, of course, is people are more aware. So if they're having symptoms, they are probably more proactive. They're approaching the doctors. They're also getting, detected earlier. Then, of course, we have new things like, sedentary lifestyle. So people are, having changes in their lifestyle, whether it's food, eating more processed food, eating more of, smoked, salted food, which themselves are risk factor for, for cancers. People are also having obesity, and obesity has a link with cancer. It's a major risk factor for developing cancer. So these are some of the many reasons why we are seeing a rise in cancer.
Yeah. So breast cancer is very common to the women especially. So what are the, what about the breast cancer, and can we detect early?
Yes, so previously, we would see breast cancer in the slightly elderly people, or say 60 years onwards, 70 years, around 70s, 60s. Then we are seeing a certain shift nowadays where even younger women are having breast cancer. There are multiple reasons for this, but when you ask about the breast cancer detection, yes, we can. So there is something called screening. Okay, screening means a woman may not have any symptom, but we can still detect a breast cancer. And this is done by mammography. Okay, so bilateral mammography means you are going to do an X-ray of both the breast of a woman, and it is not done for every woman. It is advisable as per the guidelines for a woman who is 40 years and above. So any woman who has reached the age of 40 should get a bilateral, that is both breast mammogram. And this is very important. It should be done ideally at least once in every 2 years for a woman who is 40 years and above. Okay, so once you do this, you are able to detect not just lumps which may not be felt by a woman herself, but also certain changes which are seen on an X-ray. So certain changes, I mean, it may not be a mass or growth which we see on X-ray. Sometimes there are small things like calcifications. These are changes which we see on an X-ray, which could be early warning sign of a patient having cancer. Another thing which is very important is, awareness of breast. Okay, so every woman should know something called self breast exam, which means how do you examine your own breast. So today, in fact, in next 2 days, I'll be teaching every woman how to do self-breast exam, which means every month you have to check your own self, your own breast, once a month at least. Okay, and I'll explain, to every woman individually how to go about this. And there's also something called clinical breast exam, which is you go to a doctor after the age of 30 or 35 onwards, and you visit a doctor, and the doctor also examines you. So these are various perspectives.
Okay, can you tell more about on the treatment option for cancer?
So treatment options for cancer it's a broad topic. Okay, so very broadly, cancer, there are 3 main approaches. What we say, 3 main modalities. So there's surgery, which is done by the surgeon, where they remove and they operate on the tissue and they remove the tumor. And then there's the radiation oncologist, that's us. We give radiation by radiation machines, and these radiation machines will target the X-rays to the tumor or the target area. And then there's chemotherapy or targeted therapy or immunotherapy, which are done by the medical oncologist. So these are the 3 main modalities. Now, cancer is a very complex disease, and the treatment really depends on so many factors. It depends on, for example, what is the stage of the disease, right? So where has it spread? What is the extent of spread? What is the site, which means which is the location that it has started from? Okay, where all has it gone? And also on the pathology, which means what is the type of cancer we're dealing with, because depending on the type, even the treatment differs. Okay, and it also depends on factors like, does the patient have any other comorbidities, what we say, like heart diseases or kidney issue or diabetes, hypertension. Are they fit enough to walk? Are they fit enough to take care of themselves? Then there are other factors like accessibility to treatment, cost. So we take all of these factors into account. And then, of course, the treatment will be a combination, whether is it surgery alone, is it surgery with radiation. Sometimes you give radiation before the surgery. Sometimes you give chemotherapy before the surgery, after the surgery, right? So all of this, it's a complex decision. And that is why it's very important, so we have something called MDT. MDT basically means multidisciplinary tumor board. Okay, it means it's a team. So cancer treatment now is not like before, where, for example, a patient would probably go to one doctor and the doctor would say, okay, this is the treatment and you get it done. It's different now, okay? So it's a team, it's a teamwork. So the whole team sits together, and the team will be comprised of so many people. It'll be, for example, a pathologist who will be diagnosing, because the most important part, first step, is correct diagnosis. And that is confirmation of the cancer by a pathologist, okay? Then, of course, we have radiologists who will do, for example, the chest X-rays or the CT or, MRI, and they will interpret where all the disease has spread. Then we have nuclear medicine people who do the PET scans, for example. They report the PET scans. Then, of course, we have the surgeon, the radiation oncologist, the medical oncologist, who will decide how to go about what approach. We also have, the nursing staff, we have dietitians, we have dentists who will probably look at the dental fitness of the patient. If we require radiation to this area, we would require dental clearance. So many things, speech and swallowing specialist. And if there are certain cancers where there's a strong family history, we are finding mutations in the family, we might also refer to a genetic counselor who will advise, about what are the screening strategies and all that. So it's complex, but that's the way forward. Yeah.
So, ma'am, we have when we discuss on this cancer treatment,
Yeah.
During this free 3 days medical camp that is began today,
Yeah.
do your experience like during this free medical camp, how do you find a person has been with a cancer? So, what are the common that you have been detected?
Yes,
during
no,
this
so
thing?
firstly, we are looking at the employees of these offices who are coming and we are educating them. So we are raising awareness, number one. Number two would be what are the warning signs of cancer, right? So not all people, so it really depends on what cancer we are talking about. But very vaguely, some of the common warning signs are if you're having weight loss, unexplained weight loss, if you're having a cough which is just not going away, or if you're having bleeding, okay, a woman who is postmenopausal, who has attained menopause and he's having bleeding, or a woman is having painful intercourse with bleeding. These are some of the warning signs. Or you're having a lump, you are feeling a lump in your breast. So that could again be an indication of breast cancer. So these are things which we are making them aware. And if there's something which is suspicious, then of course we are directing them to get themselves further evaluated.
Okay. So, ma'am, the Medanta Hospital, signing an MOU with the Nagaland Government, for accreditation of this Chief Minister Health Insurance Scheme. So, on regard to this, is the Medanta Hospital, give the facility, cover under this for cancer treatment or not?
Yes, it is covered. Okay, so the Nagaland CM, HIS card, it covers the, the health scheme. It's a health scheme which is going to help all the people who have this card avail the services, the treatment services at Medanta. And we've had quite a few patients who have been treated. I can speak from the radiation oncology perspective. We've had patients treated in our department using this scheme. So, of course, at Medanta, we do have the advanced radiation machines and also the radiation techniques, which we are able to help. And we have had quite a few patients from Nagaland who have benefited. And it's a really, proud thing that we are able to help, people in this way. And we look forward to helping more people.
Okay. So through this initiative, how the Medanta Hospital is looking forward in future, to provide the health services in the Northeast, especially in the state of Nagaland?
I think this is the beginning. We are trying to reach out to as many people, create awareness, and this is always just the first step. We hope that things escalate further and we're able to help as many people come forward.
So lastly, what will be your advice, to the people on this healthcare condition or the problem, on regards to the public on cancer treatment and all?
So the first thing is you have to make health priority. Okay, your health matters. It's the most important thing. So you have to make it a priority. If there are complaints, if you are feeling unwell and there are symptoms which are just not going away, it's troubling you, do not postpone your visit to the doctor. That is very important. Most of the time people even feel shy, or there are other issues, practical problems. Sometimes you have exams going on or something or the other going on, but you have to kind of understand that health is priority. That's the number one. Number two is be mindful of what you eat, what you do. Okay, so that means watching your weight, try not to be obese, look out for not eating processed foods, processed meat. Smoked food is not good, processed foods are not good. So, eating a healthy diet, doing a little bit of brisk walking per day, these are very important. So to the public, it is important. And of course, if to a cancer patient, I would say that you have to be very open, have frank discussions. Once you have had a diagnosis of cancer, you have to talk to your oncologist, understand all the treatment options available, and whatever doubt you have, be free and frank. And that's the way forward.
So what will be your advice you want to give out to the public, especially on this health diet and on this health condition, the problem, and on cancer treatment and all?
Yeah, so my advice to the public is, number one, make health your priority. Health is the most important thing, and if you have disturbing complaints or symptoms which are just not going, like I mentioned, the warning signs, you have to visit a doctor at the earliest. You have to really prioritize yourself. Many times people kind of delay or postpone a visit to a doctor thinking, so many issues, right? Sometimes it's practical reasons, but try and make yourself the priority. Okay, this is very important. This is the most important advice. Second thing is you have to be mindful of what you eat. Try and avoid the processed foods, red meat. Try to reduce the red meat consumption. Smoked foods are not good, so you can avoid that. Eat more of high fiber, high good protein diet, vegetables, seasonal fruits, seasonal vegetables, home cooked food of course is the best. Avoid junk food. And if you have bad habits like tobacco, chewing tobacco, pan, gutka, smoking, everyone knows this, smoking alcohol, you have to stop it because there's no other way. And be mindful of your weight as well, because obesity has a direct link with many cancers. In fact, 13 plus cancers are directly linked with obesity. So if you have obesity, you are definitely at higher risk of developing some form of cancer, and especially the main ones being breast, ovary, endometrium, colorectal. These are some of the cancers which have a link with obesity. So you have to watch your weight. These are some important advice I would like to tell the public. And then, of course, to cancer patients, the ones who are already diagnosed, maybe freshly diagnosed or undergoing treatment, what I would say is have very frank discussions with your oncologist, the one who's treating you. So if you have a doubt, you should ask that. If you have a complaint, you have to express it, okay? Because there's no one better than the oncologist who is going to guide you better. Many people kind of start asking around, and then they get complete misinformation, and that's where a lot of confusion also sets in. So have frank discussions with your oncologist. If you remember something, keep a notebook with you. Maybe just jot down some notes, and then the next time you visit your oncologist, you can say it. And then, of course, we also have support groups, okay? So we have cancer support groups which are active in the state. In fact, there's Beyond Cancer group. They're doing a good job. They help cancer. So cancer patients, survivors, they come together. Because, a cancer survivor or cancer patient would understand also your problems better. So there's, of course, the role of cancer support groups. And it's really just about understanding better everything, whether it's your treatment options, accessibility to whatever are the treatment options available. Sometimes we have very rare cancers which don't have available guidelines, which means people in the world, oncologists in the world, would probably not even know how to deal with a certain cancer. So these are very rare cancers. So, we have something called tumor boards with, specialists from all around the world where we discuss rare cases. And this is also another perspective.
Nagaland TV, Sop Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube, and Twitter.